Hi, my name is Sasha Ryan. I'm one of the counselors here at New London Counseling Center, and today I'm going to be talking to you about mindfulness. Before we get started on that, I want to tell you a little bit about us here at New London Counseling Center. Um, our mission here is to help our entire community grow, connect, and heal, even if you never step foot in our doors. We host live stream events and present at local businesses, and we are a nonprofit and receive funding from the generous support of our donors. We hope that you could join us in our year-end giving campaign Project Peace of Mind so that we can continue to host live stream events and provide financial assistance to our clients and their families who might not otherwise be able to afford counseling services. For any information on our year-end giving campaign or just on New London Counseling Center itself, you can check us out at www.newlondoncounselingcenter.com. And information on our year-end giving campaign is at the bottom of the screen. So getting into the topic today, an introduction to mindfulness, we'll go over some history, some clinical results. We'll go over the definition of mindfulness, and I'll break that down further into three distinct parts. And then we'll do an actual mindfulness practice, a 3-minute seated breathing exercise that you could do anywhere, anytime in your everyday life. And finally, we'll finish off with some feedback, some questions to think about after your mindfulness practice is over that you can answer in a journal or to talk to someone that you feel comfortable confiding in about. And throughout the presentation, I'll be switching back to this video and a PowerPoint that I've created for those of you who learn better from seeing something visually. So ultimately, I want you to take away what mindfulness is, how it works, and a simple way that you can implement it in your everyday life to help reduce stress. So diving into the history of mindfulness, modern mindfulness-based approaches were developed by a guy named John Kabat-Zinn in the late 1970s. He's actually a medical doctor out of University of Massachusetts Medical Center, and he also started the Mindfulness Center up there and developed what's called mindfulness-based stress reduction. He's seen most significant improvements in patients suffering from chronic pain and stress. And then in the early 1990s, three mental health clinicians, Teasdale, Williams, and Segal, believed that they could use these mindfulness techniques to help people dealing with depression, so help prevent relapse of depression. So together, based on this belief, they created what we know as mindfulness-based cognitive therapy. So there's been multiple studies done on the effectiveness of mindfulness-based cognitive therapy as well as mindfulness-based stress reduction. But 6 trials in particular carried out all over the world that have evaluated MBCT and depression have shown that in patients with 3 or more previous episodes of depression, the mindfulness-based cognitive therapy reduced the recurrence rate of the depression by 40 to 50% compared with usual treatment. And usual treatment being probably some sort of talk therapy or possibly some sort of antidepressant, or a combination of the two. So the main takeaway here is that mindfulness-based cognitive therapy has proved to be as effective as maintenance antidepressants in preventing new episodes of depression. And so in today, we use MBCT not just for depression. So it's also used for people dealing with anxiety or trauma, or there's even a MBCT program created just for kids. So it's not just for depression, even though that was the original creation. So the actual definition of mindfulness is the awareness that emerges by paying attention on purpose in the present moment and without judgment. And the main keys here are that you're paying attention in the present moment. So you're not thinking about the past or what you have to do later on. You're just in the present moment and without judgment. And we'll get a little bit more into that as we go. So, what does paying attention mean? So, we could be paying attention to our thoughts, we could be paying attention to our body, or we could be paying attention to our breath. It means just noticing what's going on in our mind, maybe sensations that we feel in our body, what thoughts come up when we're practicing. And then paying attention to our breath often means, where do we feel the breath most strongly? So, do we feel the breath in the abdomen, in the rising and the falling of the abdomen? Do we feel the breath in the chest? Or do we feel the breath most strongly in the nostrils? The cool sensation on the inhale, the heat on the exhale. Just noticing where you feel that. And oftentimes in mindfulness practice, we'll talk about coming back to your breath. And all that really means is our breath is always in the present moment. And our breath is a good place to find grounding in the present moment. So when we get lost in thoughts of what we have to do today, or a conversation that didn't go well with someone, when we're just sitting in silence, we often can bring ourselves back to the present moment by coming back to the breath. So moving on, in the definition we talked about paying attention. So paying attention to what's going on in your body or your thoughts or even the breath. In the present moment, which means just from one moment to the next. And then we talked about without judgment. A lot of times judgment can be misconstrued or some confusion around there. So we often liken it to a sense of acceptance. So having a sense of acceptance about our mindfulness practice. So oftentimes, especially when you're first starting out with a mindfulness practice, your mind might be racing. I know for me personally, even now when I sit down, a lot of times I'm thinking about, what do I need to do today? What do my kids need? Maybe I'm thinking about things I need to do at work. My mind's just racing and going 100 miles an hour with all the to-dos and things that I could squeeze in. So instead of judging myself for that, just having a sense of acceptance and bringing a sense of awareness that that's where how my thought process is going right now. And we create this sense of acceptance by cultivating kindness toward ourselves. So kindness and curiosity regarding the thoughts that come up when we're sitting in our mindfulness practice. So there can be kindness toward our thoughts. So recognizing that thoughts that come up are not the enemy, kind of holding them in friendly, interested awareness. So just being curious about the thoughts that come up. And then there can also be practicing kindness and acceptance toward ourselves. So just accepting that this is where we're at in this moment, whether that's I'm calm and I'm really focused on my breath, or whether that's I can't stop all these thoughts and my mind is all over the place and I'm thinking about this and I'm thinking about the past. Ultimately, just accepting this is your experience in this moment. This doesn't negate the fact that there often is room for change. But when we practice kindness and self-acceptance, then we can more clearly see areas in our life that we'd like to change and how we could go about doing that, whether it's changing our thoughts or changing something specific about ourselves. So next we'll move into this idea of making space. So if you think about the original definition of mindfulness, it's an awareness that emerges. So awareness that emerges can be likened to kind of creating a sense of space around things that might happen in your life. So think of a time when someone said or did something to you that you did not like. So go ahead and really consider a time when someone did something that you didn't like. I know I can definitely think of one. So what the person said or did, that was the negative stimulus. And we typically react immediately and negatively when a negative stimulus presents itself. And often we later regret that. But what if we could create some space between this negative stimulus? So create some space around someone said or did something negative to me and our response to them. So that would look like, instead of reacting immediately with, saying something mean back or doing something mean back, we could kind of take a minute, take a few minutes, however long you need, to kind of notice with kindness what's going on in our mind and even what's going on in our body. So this act of noticing kind of creates that time and space so that we can intentionally respond versus reacting. So a personal example, recently a friend texted me and she said that she was upset because she felt like I wasn't putting as much effort into our friendship as she had been, or that I was pulling away from her, and that overall she was just disappointed with our friendship. And I immediately got very defensive and very upset. I pride myself on being a good friend, putting time and effort into my friendships. And so this really hurt me. Um, and I also felt like, she should understand how busy I am, having a life and having children and having a career and a husband. And I didn't feel like she was being understanding of that. So I didn't say something necessarily mean back, but I immediately texted her back with, you don't put much effort into the relationship either. We're both guilty of that. And I'm really busy, and kind of just making excuses and being extremely defensive. But had I practiced some mindfulness, had I, read the text, which in itself kind of creates this environment where I can step away. She didn't say this directly to my face, so I could have read the message. I could have noticed what was going on, which was anger, which was some fear that, I wasn't living up to being a good friend, which was, some sensation in my stomach, because that's where I carry a lot of emotion, and maybe some sensation in my shoulders. That's where I carry a lot of emotion as well. And I could have maybe done a breathing exercise, or just taken a few minutes to be silent. Um, and this would have allowed me to create that space I needed to have a better response instead of just reacting. So my response could have been something like, I'm very sorry, that you feel this way. Um, I too am feeling, like I'd like more out of our friendship. Here are the things that I think I could do better. What do you think we could do better to resolve this issue and avoid it going forward? So the mindfulness doesn't mean that I notice what's going on and I don't change. It means I notice what's going on in my body, and then I do make the choice to change my response, to change my behavior, to change my thoughts, to change ultimately how I develop this friendship. So I hope that you guys all were able to think of an example, and if you weren't, in this specific moment, maybe moving forward, the next time someone says or does something negative, then you can think about this. Think about creating that space. Think about walking away for a few minutes to think and notice with a sense of kindness what's going on in your body. And then come back to the table and be able to respond to them rather than react. So moving on, we're going to get into our actual mindfulness practice. And our mindfulness practice today is going to be a 3-minute breathing exercise. And this is something that you can do just about any time, anywhere. I know I'm a busy mom, and I have 3 minutes throughout the day. Maybe not when I'm driving or when my kids are needing something from me, but definitely early in the morning or after I drop them off from school, if I have 3 minutes to just sit in my car and do a mindfulness practice, or if I have a few minutes in between seeing clients. So we can all find 3 minutes in the day to practice a little bit of mindfulness. So hopefully you're already sitting in a chair and you're fairly comfortable. If not, I recommend that you sit in a chair or sit on a pillow on the floor and just get comfortable. You can have a soft gaze toward the floor, or you could even gently close your eyes. Whatever makes you feel most comfortable. Allowing your hands to rest softly in your lap or on your legs, just allowing them to be supported. You want to sit up nice and tall, so maybe rolling your shoulders up and back. Think about maybe a string from the top of your head toward the ceiling, lifting you up to sitting nice and tall. And with your soft gaze or your eyes closed, just think about relaxing the muscles of the face. Think about relaxing the skin around the eyes. Think about the ears sliding down the side of the head. If your tongue is on the roof of your mouth, think about pulling it away from the roof of your mouth and letting it rest gently. So for the first minute, we're just going to notice. We're going to notice body sensations, notice thoughts, notice any feelings or emotions that come up. Don't try and change anything. Just notice. Notice and invite that sense of kindness in. A sense of kindness toward the thoughts that are coming up. A sense of kindness toward maybe some discomfort you feel in your body. Don't try and push anything away. Just allow it to be here. And notice. For minute 2, we'll focus on our breath. So notice where you feel the breath most strongly. Maybe in the rising and the falling of the abdomen. Maybe in the chest. Or maybe in the nostrils. Knowing there's no right or wrong place to feel the breath. And not trying to change the breath in any way. Just noticing where you feel it most strongly. And when your mind wanders, like the mind likes to do, just gently ushering yourself back to the breath. Just with a sense of acceptance that the mind has wandered, sense of kindness, and bring yourself back to the breath. Again and again, as many times as it takes. And for minute 3, we'll expand our awareness to the whole body. Noticing any areas of discomfort or unease, or maybe you have areas that seem to be of ease. Maybe you notice some tingling or sensation in different areas of your body. Whatever you experience, just noticing with a sense of kindness and curiosity, being aware of the whole body, and knowing there's no right or wrong. And as this practice comes to an end, you can wiggle your fingers and toes. If your eyes are closed, you can gently open them, coming back to the space that you're in. So next we'll go over how you felt about this practice, some feedback questions. So the 3 questions in mindfulness-based cognitive therapy that we often ask after we do any kind of mindfulness practice. The first being, what did you notice? So when you were sitting there, what did you notice? Did you notice your body? Did you notice any sensations? Did you notice racing thoughts? Did you notice where your breath was? Oftentimes, if you're new to mindfulness, you'll really notice maybe that your mind was just going constantly and that it was difficult to come back to the breath. The next question we often ask in MBCT is, how is this different from how you usually relate to your body? So do you normally notice what's going on in your body this much? Do you typically notice different sensations or areas of unease? Maybe you notice more pain or more unease than you normally do because you were simply paying attention to your body. That's really common. And finally, what does this have to do with preventing stress, depression, or anxiety? How can noticing what's going on in our body and our thoughts help us to prevent stress, depression, or anxiety? A lot of times in MBCT we talk about how noticing the feelings and the thoughts and even the body sensations associated with stress, depression, anxiety, or any unwanted feeling, how sitting with them, just like we sit in our mindfulness practice, sitting with them and noticing them and bringing a sense of kindness to these unwanted emotions often allows them to pass. Rather than fighting them or fighting the mind or fighting anything, we just sit with it and we often allow it to pass. But ultimately, these questions are for you to answer. There are no right or wrongs. My suggestions are simply from my own experience or the experience of others. So each person's experience is unique to them. There is no right or wrong experience. And that paying attention to your experience from moment to moment with kindness is the best way to practice mindfulness. So I hope that today you learned how mindfulness works, what mindfulness is, and a simple way that you can introduce mindfulness into your everyday life to help you reduce stress. If you have any questions about this webinar or any questions for the Counseling Center, again, you can check us out at newlondoncounselingcenter.com, or you can call us at 484-746-3112, or you can email us at info@newlondoncounselingcenter.com. And all of this information is at the bottom of your screen. I hope today was helpful, and I hope again that you'll consider giving to our end-of-year campaign, Project Peace of Mind, so that we can continue to provide live stream events and services to clients and families. Thank you for joining us. Bye.